The question that keeps most people awake at night isn't, which medication will I need, or will I need another procedure? It's much deeper than that. Is my life over? Can I still travel? Can I still exercise? Will I ever feel like myself again? If you've asked yourself any of those questions, you're not alone. Here's what I want you to hear before anything else. For most people, the answer is yes. Yes, you can still travel. Yes, you can stay active. Yes, you can enjoy time with your family, pursue your hobbies, and live a full, meaningful life. A Sjogren's diagnosis does not automatically take those things away. But there is something you need to understand. When doctors follow patients over the years, they see a clear pattern. The people who continue living well aren't just lucky. They consistently do a handful of things differently. In fact, there are 6 habits that often separate the people who stay comfortable, confident, and in control from those who find themselves housebound, exhausted, and watching the conditions slowly take over their life. Let's go through those 6 habits, because they can make all the difference in the years ahead. The honest picture first. Let me start with honest context, because you deserve the full picture, not just reassurance. Sjogren's is real, and it's more than just dry eyes and dry mouth. It's a chronic autoimmune disease in which the immune system mistakenly attacks the glands that produce moisture, primarily the tear and salivary glands, but the effects don't stop there. Research shows people with Sjogren's carry a modestly increased overall cancer risk, along with a substantially higher relative risk of non-Hodgkin lymphoma compared to the general population. Fatigue affects roughly 2/3 to 3/4 of patients, and in patient-reported surveys, fatigue, dry eyes, dry mouth, joint pain, and brain fog consistently rank as the symptoms with the biggest day-to-day impact. Notably, more than half of the most commonly reported symptoms in large patient surveys aren't even related to dryness at all. That's the part most people are never told. Sjogren's can also bring joint pain and occasional joint swelling, muscle aches, dry skin, a chronic dry cough from tracheobronchial dryness, difficulty swallowing, Raynaud's phenomenon, where fingers turn white or blue in the cold, vaginal dryness, and in a smaller subset of patients, involvement of the lungs, kidneys, or peripheral nerves causing numbness or tingling. Fibromyalgia coexists in roughly 1/3 of patients. None of this is meant to overwhelm you. It's meant to explain why just use eye drops was never going to be enough advice, and why the 6 habits in this video look at the whole picture, not just the 2 symptoms everyone associates with this disease. Those numbers are real. They matter. But here is what that same research also shows. The symptom burden that drives most of the suffering in Sjogren's is exactly the part you have the most power over. Unlike the antibody in your blood work, your daily habits are something you can change starting today. Let me tell you about a patient I'll call Diane. She was 52, a school teacher, newly diagnosed after 2 years of being told her dry eyes were just allergies, and her exhaustion was just stress. When she finally got the diagnosis, she felt almost relieved to have a name for it, and then terrified. She started avoiding restaurants because chewing was uncomfortable. She stopped going on evening walks because she was too exhausted after work. She noticed her fingers turning pale and painful in the grocery store's frozen aisle, and had no idea it was connected. She told me, "Everyone talks about the eye drops. Nobody told me what to actually do with my life." That conversation changed everything for her. Today, I want to have that conversation with you. Here's something that surprises most patients. Research comparing Sjogren's patients to healthy people of the same age finds meaningfully worse quality of life across pain, fatigue, disease activity, swallowing difficulty, and anxiety, not just dry eye scores. One large longitudinal study found the negative impact on quality of life is comparable to that of multiple sclerosis or kidney dialysis. This is a whole-body disease, even though it often gets treated like an eye and mouth problem. But here's the equally important flip side. Consistent, targeted management of these 6 areas is repeatedly shown to reduce that burden. This isn't about curing Sjogren's. It's about not letting Sjogren's define your day. Now let me give you the 6 most important things for living well with Sjogren's. These aren't opinions. They're drawn from Sjogren's Foundation clinical practice guidelines, EULAR lifestyle and treatment recommendations for rheumatic disease, and the dental, ophthalmology, and rheumatology research behind them. Number 1. Protect your eyes like it's a daily job, not an afterthought. Untreated dry eye in Sjogren's isn't just uncomfortable. Left unaddressed, it can lead to corneal damage and permanent vision problems. Ophthalmology guidance is consistent on the fundamentals: preservative-free artificial tears used proactively rather than only when your eyes feel bad, environmental control like running a humidifier and wearing wraparound sunglasses or moisture chamber goggles outdoors, and avoiding direct airflow from fans, car vents, or HVAC systems blowing across your eyes. For patients who don't get enough relief from drops alone, several additional layers of treatment have real evidence behind them. Topical cyclosporine has been shown in randomized trials to be safe and effective for dry eye related to Sjogrens, improving tear production, reducing corneal damage, and increasing the density of the mucus-producing cells on the eye's surface. Punctal plugs, which block the ducts that normally drain tears away, are a well-established next step for some patients, though the research on how consistently they help is more mixed than for drops or cyclosporine. Prescription oral medications like pilocarpine and cevimeline stimulate the glands themselves, and multiple randomized trials have found they meaningfully increase tear and saliva production and reduce the subjective feeling of dryness, though they can cause side effects like sweating or a fast heartbeat in some patients. This is maintenance, not crisis management. The goal is to never let your eyes get dry enough to hurt in the first place. Number 2, treat your mouth like your teeth depend on it, because they do. This is the one patients underestimate the most. Reduced saliva doesn't just cause discomfort, it strips away one of your mouth's main defenses against bacteria and acid, since saliva normally clears food debris, buffers acid, and delivers minerals that repair tooth enamel. Sjogren's Foundation dental guidelines recommend prescription-strength topical fluoride as the first line of defense against the dramatically elevated cavity risk that comes with dry mouth, and a 24-month randomized, placebo-controlled trial of fluoride varnish found it slowed the development of new root and coronal decay in Sjogren's patients compared to placebo. Beyond fluoride, sip water throughout the day instead of sugary or acidic drinks, use sugar-free gum or lozenges to stimulate what saliva flow you have left, and consider a saliva substitute for times when your mouth feels driest. Patient preference research suggests thin, watery, neutral-flavored sprays are generally best tolerated. See your dentist more often than you think you need to. One population-based study found patients had nearly double the dental visits and dental spending of people without Sjogren's even before their diagnosis was made, and staying ahead of decay is far easier than treating it after the fact. Watch, too, for oral thrush, a fungal infection that's more common when saliva flow is reduced. A persistent white coating or burning sensation in the mouth is worth mentioning to your dentist or doctor. Number 3. Move your body, moderately, consistently. It sounds backwards when fatigue is already crushing you, but this is one of the best supported interventions in Sjogren's care. Clinical guidelines state plainly that regular exercise reduces fatigue in Sjogren's to a similar degree as it does in rheumatoid arthritis, lupus, and multiple sclerosis, and researchers following the World Health Organization's activity recommendations have linked meeting those targets to meaningfully better health-related quality of life in Sjogren's patients. Exercise also helps with the joint pain and muscle aches that affect a majority of patients, by maintaining flexibility and reducing stiffness. You don't need to train for anything. Walking, swimming, gentle cycling, or yoga, most days of the week, is the target. Start small and build gradually rather than pushing through a hard workout and crashing for 2 days afterward, which is a common and demoralizing pattern for people managing autoimmune fatigue. Diane started with 15-minute walks after dinner. Within 2 months, she told me her afternoon energy crashes were less severe and less frequent, and by month 4 she'd worked up to 30 minutes most days. Number 4, build your plate, and your habits, around reducing inflammation. An anti-inflammatory eating pattern rich in omega-3 fatty acids, oily fish, olive oil, flaxseed, has been linked to lower inflammation markers in Sjogren's patients, and staying well hydrated helps keep both oral and digestive tissue lubricated, not just your mouth. Some patients also find that acidic or highly spiced foods aggravate an already sensitive dry mouth, so this is worth tracking individually. On alcohol specifically, it's a known drying agent for already compromised salivary and lacrimal tissue, so most oral health and rheumatology guidance recommends limiting it, particularly if dry mouth or dental decay is already a problem for you. This isn't about a perfect diet. It's about noticing which foods and drinks make your dryness, reflux, or fatigue worse, and adjusting accordingly. Because dry mouth and swallowing difficulty can make eating harder in general, some patients also benefit from softer foods, extra sauces or gravies, and taking smaller bites with more frequent sips of water during meals. Number 5. Take fatigue and mental health as seriously as your rheumatologist does. This is the symptom I see dismissed the most, and it shouldn't be. Studies following Sjogren's patients find that fatigue and disease-related sleep disruption feed each other in a loop. Poor sleep worsens next-day fatigue, and unmanaged fatigue makes restorative sleep harder to get. A cooler, darker bedroom, a wind-down routine without screens, and treating fatigue as a genuine symptom to report, not just part of having an autoimmune disease, all show up in the research as meaningful levers. There's a piece of this that rarely gets discussed openly: mental health. Cross-sectional studies have found anxiety in roughly a third of Sjogren's patients and depression in slightly more than a third, both significantly higher than in matched healthy controls. This isn't a weakness or a coincidence. One detailed statistical analysis found that depression actually mediates much of the relationship between pain, fatigue, sleepiness, and overall quality of life, meaning that treating depression when it's present can meaningfully soften the impact of the physical symptoms too. Oral health problems and swallowing difficulty were specifically linked to higher anxiety in that research, which is one more reason the dental and dry mouth care in Habit 2 isn't a side issue. It's connected to how you feel emotionally as well as physically. If your mood has shifted since your diagnosis, that's worth bringing to your doctor with the same seriousness as a new physical symptom. Number 6. Watch for the warning signs beyond dryness, and don't skip your follow-ups. Because Sjogren's carries a real, elevated risk of non-Hodgkin lymphoma, with research putting the relative risk many times higher than the general population, even though the absolute risk for any individual patient remains low. Persistent swollen glands, unexplained lumps in the neck or under the jaw, drenching night sweats, or unexplained weight loss are symptoms that should never wait for your next scheduled visit. This same don't wait principle applies to other systemic warning signs: new numbness or tingling in the hands or feet, unexplained shortness of breath, changes in urination, or persistent, unusual muscle weakness can all signal that Sjogren's is affecting the nerves, lungs, or kidneys and deserve prompt evaluation rather than a wait-and-see approach. This isn't meant to frighten you, it's meant to make sure you and your doctor are watching the same things. Regular blood work and check-ins aren't bureaucracy, they're how this disease gets caught early if it changes. Where medication fits in. Lifestyle habits are not a replacement for medical treatment, and it's worth understanding where medication fits alongside them. For dryness itself, pilocarpine and cevimeline are the two prescription options with the strongest trial evidence for increasing saliva and tear production. For patients with more significant systemic symptoms, joint pain, fatigue, or broader disease activity, hydroxychloroquine is commonly used, and a large real-world study found higher response rates at standard doses compared to non-users, though a separate placebo-controlled trial did not find a significant benefit for the combined symptom score of dryness, fatigue, and pain, so its effectiveness appears to vary by individual and by which symptoms are being targeted. Newer biologic therapies are an active area of research, and your rheumatologist is the right person to walk you through whether any of these make sense for your specific case. None of this replaces the 6 habits above. The research consistently treats medication and lifestyle management as working together, not as alternatives to each other. Not every Sjogren's patient faces the same situation. If you have primary Sjogren's with no other autoimmune disease, your management may focus heavily on these 6 areas plus symptom-targeted treatment. If you have secondary Sjogren's alongside lupus, rheumatoid arthritis, or another connective tissue disease, your overall disease burden, not just your Sjogren's symptoms, will shape your care plan, and managing both conditions together is essential. If you're a woman of childbearing age, it's worth knowing that Sjogren's is associated with certain antibodies that can, in rare cases, affect pregnancy, so preconception counseling with your rheumatologist is a reasonable step if you're planning a family. Both broad situations, and everything in between, are valid, and the right approach depends on your specific picture. Here's your practical action plan. 6 steps you can begin this week. Step 1. Start using preservative-free artificial tears proactively, several times a day, not just when your eyes already hurt. Ask your ophthalmologist whether punctal plugs, topical cyclosporine, or an oral medication like pilocarpine or cevimeline make sense for you. Step 2. Book a dental visit and ask specifically about prescription fluoride for dry mouth caries prevention. If you haven't seen a dentist in the last 6 months, that's your first call this week. Keep water within reach and consider a saliva substitute for the times you feel driest. Step 3. Pick one form of moderate movement and commit to 15 minutes most days. Walking counts. Build from there gradually, and don't be discouraged if you need more rest days than someone without Sjogrens. Consistency over time matters more than intensity on any single day. Step 4. Add one omega-3 rich meal this week, keep water nearby throughout the day, and pay attention to your alcohol intake if dryness or dental issues are a problem for you. Notice, and write down, which foods seem to make your symptoms worse. Step 5. Fix one piece of your sleep environment, temperature, darkness, or screens before bed, and report your fatigue level, and your mood, honestly at your next appointment. If you've noticed persistent low mood, anxiety, or loss of interest in things you used to enjoy, say so. It's treatable and it's connected to how your physical symptoms feel too. Step 6. Learn the warning signs: persistent gland swelling, unexplained lumps, night sweats, unexplained weight loss, new numbness or tingling, or unusual shortness of breath, and know that these get a call to your doctor, not a wait and see. A few questions patients ask often. Will Sjogrens get worse over time? For many patients, the disease is slow-moving and stays fairly stable for years, especially with consistent management of the 6 areas above. For others, particularly those with certain antibody patterns, there's a higher chance of systemic involvement, which is exactly why the regular monitoring in Habit 6 matters. Is Sjogrens fatal? Sjogrens itself is rarely life-threatening. The serious risks, lymphoma, significant lung or kidney involvement, are uncommon and are precisely what routine follow-up is designed to catch early, when they are most treatable. Can I still have a normal social life? Yes, with some planning. Carrying eye drops and water, choosing restaurants with easier-to-chew options, and being upfront with friends and family about needing occasional rest are small adjustments, not a smaller life. Where Diane is now. Diane still has Sjogrens. Her eyes still need drops most days, and she still gets tired in a way she didn't before her diagnosis. But she's back to walking after dinner. Her dentist says her cavity risk has stabilized. She started taking hydroxychloroquine after discussing it with her rheumatologist, and she went to her niece's wedding last spring and stayed for the whole reception. Her Sjogrens didn't disappear. It just stopped running her life. That's what I want for every patient watching this. Sjogrens is a serious diagnosis, I will never minimize that. But it's also one of the most manageable chronic autoimmune conditions when patients are informed, consistent, and supported, both physically and emotionally. What you do with your daily habits matters more than most people are ever told. If this helped you see your diagnosis differently, please share it, especially with anyone newly diagnosed who feels like nobody explained what happens after the appointment.